Day of surgery, you will not have had anything to eat or drink after midnight, the midnight before the morning of surgery. We'll come say hello, we'll cross all the T's, dot all the I's on all the forms that we have to fill out. The surgery will be between 1 and 3 hours. Of course, that can be quite variable depending on what surgery you're having, whether you're having a gallbladder too, etc. You can expect, though, that your family members or friends who might be with you may not see you for several hours, so 4 to 6 hours or so, because it takes time to get the patient to sleep on the operating room table, time to wake up, time to get out of the recovery area, time to get up to the nursing floor. We're going to get you out of bed right away. We're really harping on these blood clots, okay? We hate blood clots. This is one of the most preventable things we can try to take care of is preventing blood clots. And so if we get you out of bed walking, it's not because we're trying to punish you, it's because we want you to not get blood clots. And so that will happen the day of surgery. Okay. After surgery, you're going to start drinking water right away. You can start as soon as you're awake enough to swallow and not choke. Several hours after surgery, you can start drinking water. And then once you've had enough water to drink, once you've demonstrated that water is going through well and it's not coming back up, the swelling is not too bad, then you can start on some protein shakes. And these are the protein shakes that you're going to be taking at home after surgery too. And we'll start them here in the hospital. In the meantime, you're getting out of bed and walking. We'll give you a little device to help you measure how well you're breathing. It's called an incentive spirometer. And then once you've established that you can drink a fair amount and we're confident that you're not going to become dehydrated once you get home, then you can go home. So that might be on day 1 after surgery. It might be on day 3 after surgery, as soon as it's safe. At home, so you're going to be walking, of course. That's the best exercise for starters. Don't try to push it too quickly and go to the gym, although if you're feeling great, okay. But your source of protein in this period is going to be these protein shakes. And so 45 to 60 grams of protein a day, that's low for the average daily needs that a person has in general, but it's enough to keep you going during this phase of your recovery. It's enough to keep all the bodily functions working while you're recovering from surgery. So you'll be working on that. And most importantly, you'll be working on taking enough water. So 50 to 60 ounces, 64 ounces is a half gallon, right? So you're going to be drinking about 2 quarts or a half gallon of water a day. And again, you're going to be doing it with small, tiny sips. So you're going to be drinking constantly. There is some post-op nausea occasionally. Usually that's gone within the first 24 hours after surgery. In other words, usually that goes away before you even go home. Rarely a patient might be nauseated persistently, so if that happens, call us. In fact, call us for lots of different reasons. We'll talk about that in just a moment. You may have a lot of energy after surgery. Some people bounce back really great. Their blood sugars are already normal. They feel fantastic. But some patients, and it's impossible to predict whether it's going to be a patient who was energetic before surgery or not, might be fatigued, and that fatigue might last for a month or 2. It does get better. It does go away. You will start to feel the benefits.
Once you've had your surgery, people asked earlier about hospital stay and so forth. So once you've had the surgery, band patients oftentimes go home the same day unless they have some real bad medical problems, and we keep them overnight. Otherwise, you can go home. People who've had the gastric bypass or the sleeve usually stay at least 1 night in the hospital. Because the first night you're going to have a little bit of pain, but more so is you can't hydrate yourself well. This is going to be the big change after that surgery. If before the surgery you were able to guzzle down 8 ounces of water in 10 seconds, that's not going to happen after surgery for a while. You're going to be sipping slowly, tiny, tiny, tiny sips. And at the beginning that's just not enough, and it may take some people a day or 2 to catch up. Some people can drink a pitcher or 2 or even the first night. Some people can only drink an ounce or 2. So that's different. So we keep everybody, and then we look at the next day. If people can drink well, like all my people from yesterday, my 2 people from yesterday, they were great this morning. They're all home already. So, so they go home. And then you go home, and then you can do pretty much the usual activities. Take a shower, you can walk around. If If you don't have too much pain, you can drive a car in a few days. So that's kind of the usual hospital stay for the sleeve and the bypass. And then return to normal activity. Depends a little bit on what your normal activity is. Now, some people after the sleeve and the gastric bypass, they have tremendous amount of energy because they're losing weight. They're just even 20-pound weight loss makes them so energetic. They can do all kinds of things. Other people are really tired. They're exhausted. Even taking a shower, they're completely wiped out afterwards. So it's hard to predict. So we usually tell people for your work or in general, expect to be a little bit fatigued, a little bit tired for about 4 weeks. And then afterwards, almost everybody gets a tremendous amount of energy. Okay. So for work, for most people, 4 weeks is a good time frame. I have had people who went back after 5 days. I've had people who stayed out 6 weeks. I mean, everybody's a little different, but 4 weeks is a good time frame. Same thing for physical activity. Usually people can do what they feel like they want to do. We don't give you any restrictions, but because your body will tell you they're not going to go out and lift 200 pounds. You just don't. So do whatever you feel comfortable. Any questions about the activities?
What if your job requires lifting?
Yeah, what if your job requires lifting? 4 weeks usually we take you. And again, some people take 5, some people take 6, depending how you feel. And how much weight can you lose? And Dr. Blumenthal alluded to this earlier already. There's a little difference between the procedures. So the way the weight loss works with the bypass and the sleeve, once you leave the hospital, you're not going to be hungry. You're not going to have an appetite. You're going to start with liquids, protein shakes, then slowly yogurt and other things, advance to more normal food. But the portions will be small, and you're going to lose weight no matter what. Okay? It's not going to go every day. It may be like 3 pounds one day, then nothing for a week, then another 5 pounds, and so it goes in steps. But you're going to lose a lot of weight. And that goes on for about 6 months to a year. After about the year, you will be a little bit hungry again. You will have an appetite again. And your portions will be a little bit bigger. So from 1 ounce, you go to 2 or 3 ounces. Still much smaller right now, but a little bit bigger. And then after the first year and a half, that's when you kind of have to have the good habits by that time, and then you maintain the weight. So that's the usual weight loss with the bypass and the sleeve. For the band, it's a little different because we don't fill the band until 6 weeks. So for 6 weeks, the band is really not working much for you. After 6 weeks, we fill it, and then you lose weight a little slower, like 1 to 2 pounds a week on average. And some people lose well, and some people don't. Everybody is a little different. The only big difference is with the bypass and the sleeve, everybody loses weight. With the band, not everybody loses weight. Some people lose a little bit and then never anymore. You see the numbers there, 60% for the bypass. This is 5 years numbers. Okay, this is not the first year. After the first year, most people lose even more. This is for 5 years after surgery, the average what people have kept off. So about 60% for the bypass, 50 for the sleeve, and about 40 for the band. And that's an average. That means some people lost 100%. They lost everything. They have ideal body weight. And then unfortunately, other people gain the weight back. And the surgeries are a tool. Okay? They are a helper. They are not cure your weight problem. That's still always going to be with you. So the one thing that we always say is the important thing for you, for the success afterwards, is not really what we do inside. It's what you do with the surgery afterwards. We give you a new stomach. Okay? You have a newborn stomach inside of you. So you got to learn how to eat again, just like a newborn needs to eat again. You start with baby food, and then you go to more solid food, just like a baby. So you got to teach that baby, teach that newborn some good habits. That's going to be your job after surgery, and then you're going to be successful. Okay? That's kind of how you have to look at this. People always ask, well, if we have the surgery, how can we gain weight back? The stomach doesn't stretch. How can we gain weight back? It's because people eat the wrong things. In our society, even if you have a pouch that only holds 2 ounces, If you eat 2 cupcakes, that's 2 ounces. That's 600 calories. Okay? That, you can't exercise that. To work off 600 calories, it's a half marathon. That's how much you have to run. So it's what you pick. You can eat 2 ounces of broccoli and you have 50 calories, or you can eat those 2 ounces of cupcakes and you have 500 calories. So that's going to be the choices. I mean, I'm a little extreme what I'm saying here, but that's kind of the choices afterwards that you hopefully make. And the good thing is that that first year, when you just can't eat that much, you get that chance that you never had before, that you're going to be free of all the other influences and you can learn this stuff. And you can live it and you can get that attitude. And we have all the other help. We have support groups. We have the Holly there. We have the nurse practitioner. We have dietitians. You come to see us regularly. That's everything. It's the whole program that makes it work for you. And that's why the surgery has the success rate that it has. You keep all this weight off, and 2/3 of the people, 60, 70% of the people are successful in that long. Some gain it back, but the majority keeps it off. So that's why this is a good surgery.
So this is sort of about what happens after surgery, how you live your life after surgery. So as you know, probably a lot of people in this room have tried to lose weight a lot of different ways and have been on lots of different kinds of diets, which have worked to some degree. And we know that the USDA, the U.S. Department of Agriculture, and the FDA, their recommendations are constantly changing about what's an appropriate diet. But, and so all that notwithstanding, what we know to be true, because we do this surgery and we know what works for our patients, is the kind of diet that works for our patients is a high protein diet with a low amount of fat and low amount of carbohydrates. And that's similar to some of these diets I was just sort of alluding to. But this is really what works. Now, of course, are there some healthy fats that you need to have in your daily food? Yes, of course there are. Can you avoid all carbohydrates? Probably not. But if you stick to thinking about eating protein first with every meal, every snack, you'll be successful in the long run, most likely. Okay. Now, a lot of the calories we take in are in beverages. So soda is an obvious source. If you poured out a bottle of soda and you filled it about a third or two-thirds of the way up with sugar cubes, that's the amount of sugar that would be in that bottle of soda. It's just dissolved so you don't see it. But what you might not think about are fruit juices. All right, so they have tons of sugar in them. Milk has a lot of sugar in it. So can you drink milk again? Yeah, you can have a small glass of low-fat milk or skim milk, but you can't make you can't be drinking glass after glass of milk, even though it has calcium in it and so forth. Shakes, or I should say, like ice cream shakes. But even things that are not so exotic, like when you go to Starbucks or Dunkin' Donuts and you get the mochaccino or frappuccino or whatever those things are, they have some of them up to 600, 700, 800, depending how big it is, 600, 800 calories in some of those drinks. And that's, of course, if you have whipped cream on top and whatever. But even just a coffee with, several spoonfuls of sugar, you put a little milk in, that is going to cause you to regain weight in the long run. So alcohol after weight loss surgery. Although we talk about malabsorption for some vitamins and minerals, for alcohol gets through the intestinal tract very easily and very quickly. After surgery, it gets through your intestines and into your bloodstream. That means you become intoxicated very quickly and with maybe a much smaller amount of alcohol than you're used to. So the typical person who could have maybe a couple of drinks and not feel really intoxicated will feel maybe very intoxicated even after one drink. So when it's safe to do so, which will be several months after surgery, and you want to experiment with alcohol again, you'll have to do it very, very cautiously. We don't really advocate that because there is a tendency to become addicted to alcohol particularly after surgery or people who have had that tendency before surgery. You can cause liver damage by that high concentration of alcohol in your bloodstream. So we're really not advocating that you drink alcohol, but on the other hand, is it safe to have a very small amount of alcohol once in a while after surgery? Yes, it probably is safe to do that. Following up after surgery. So I hope we're kind of beating this point into a little bit, is that this is not just surgery where you have the surgery a couple hours in the operating room, you're in the hospital a couple of days, you go home and that's it. Your appendix is out or your colon is out or your hernia is fixed. It's not like that. This is a lifelong process, and Dr. Pohl told you about how to be committed to that process. But part of that commitment is following up with us. And that's not because we feel needy and we feel like we need to see you all the time. It's because there are certain things we need to check. We need to check how you're losing weight, what kinds of foods you're eating, how much fluid you're getting, how you're doing with your vitamin and mineral supplements. We'll be taking blood periodically to check those vitamin and mineral levels to make sure you're doing okay. So we'll see you several times over the first year, and then every 6 months for the second year, and then for the rest of your life. For the band, it's a little different, but you still will be seen frequently because we need to fill or take out fluid from that band and so on and so forth. So, and the follow-up is not with just me or Dr. Pohl. The follow-up is with your dietitian. You're going to get to know your dietitian very well before surgery, and hopefully you'll develop a relationship with the dietitian and continue to follow up with that person afterwards. And that person can really help you through difficult times and can encourage you and give you very helpful information. We have support groups, and there are support groups located throughout the state. Patients who have had surgery before come to these groups and talk about issues that arise, and this is invaluable. We require actually that you go to a couple of support group meetings before surgery, just so that you have a better understanding of what life will be like after surgery. But we hope you'll make use of them after surgery too. And then also required before surgery is a meeting with some sort of mental health professional, whether it's a psychiatrist, psychologist, counselor.
So what to expect after surgery? I alluded to this earlier already. The surgery is a tool. It's the greatest tool that's out there right now. There's nothing better. If you're serious about losing weight, this is the way to go. I showed you what the success is with diet, exercise, lifestyle behavior. Unfortunately, not that great. The Powells are great tools to lose the weight, but it's not the magic cure. You are part of this whole treatment that help cure the whole journey. You make this work at the end. You gotta have to change some eating habits. You can eat normal food. People are always afraid, oh my God, I'm only gonna be on liquid diet or protein shakes forever. No, no, no. You're gonna have normal food. You're gonna go to regular supermarkets. You can go to regular restaurants. You can go out with your friends. You can go to parties. You can do all these kind of things. You're going to have a normal life. Okay. The only thing is you're going to be a lot more conscious of what you're eating, hopefully. You're going to be a lot more conscious because you learn this in the process. What is good? Where are all these calories hidden that make me so big? And you're going to avoid those because we teach you those things. We give you hopefully the tools, not just the surgery, other tools to learn and recognize where is the problem, what can I do to avoid these. Okay. That's where you're going to be successful long term. Okay. So that's why the long-term success rate is 80%. Okay. About 3/4 of the patients who've had the surgery keep the weight off for a long period of time.